Let me ask you something. Do you know what your blood pressure medication actually does? I don't mean the name of the pill. I mean, do you understand what's happening in your body when you take it? Do you know why your doctor chose this particular medication for you instead of a different one? And here's the one that really gets people thinking. Do you know what would happen if you stopped taking it? Most people can't answer these questions. They take their medication because their doctor told them to, but they're kind of in the dark about the whole thing. And I get it. Medical explanations can be confusing. There's a lot of terminology. There's a lot of fear mixed in. People worry that if they start taking blood pressure medication, they'll be on it forever. They worry about side effects they've heard about from a friend of a friend. They wonder if the medication is actually helping or just making their numbers look better on paper. So today, I want to have an honest conversation about blood pressure medications. Not a scary conversation, not a you must take this conversation, but a real conversation between a doctor and someone who deserves to understand what's happening with their health. Because here's the thing, blood pressure medication isn't about the number on the machine. It's not about making a digit smaller. It's about protecting your future. It's about preventing a heart attack or stroke that might happen 10 years from now. It's about saving your kidneys, protecting your brain, and allowing you to live a longer, healthier life. But only if you understand why you're taking it, and you're taking it correctly. Before we talk about the different types of medication, let's go back to basics about what blood pressure actually is, and why lowering it matters. Think of your cardiovascular system like a plumbing system in your house. Your heart is the pump. Your arteries are the pipes. Your blood is the water flowing through those pipes. When everything is working normally, the water flows smoothly under the right amount of pressure. But when the pressure gets too high, the pipes start to take damage, they crack, they develop weak spots. Eventually, something breaks. That's what happens with high blood pressure. The constant pressure batters your arterial walls. Your heart has to work harder and harder. The walls of your arteries thicken and become damaged. Your kidneys, which depend on delicate blood vessels to function, start to deteriorate. Your brain, which needs a precise balance of blood flow, becomes more vulnerable to stroke. Blood pressure medications work by reducing that pressure. They give your pipes a break. They reduce the strain on your heart. They allow your arteries to heal. They protect the delicate structures in your kidneys and brain. But here's what's important. The medications aren't just treating the number. They're preventing damage. Think about it this way. You don't feel high blood pressure. There's no pain. There's no obvious sign that something bad is happening. That's the dangerous part. You could have a blood pressure of 160 and feel perfectly fine. You could be having a completely normal day while your arteries are being battered, while your kidneys are being damaged, while your risk of a stroke is climbing. Medication interrupts that silent damage. It gives you a chance. There are several different classes of blood pressure medications. Your doctor might prescribe one, or they might combine several. Let me walk you through the main ones so you understand what you're taking and why. Diuretics, water pills. These are often the first medication doctors prescribe, and they've been around for decades. They work by helping your kidneys get rid of excess sodium and water through your urine. Less fluid in your bloodstream means lower pressure. Think of it this way. Your blood vessels are carrying a certain volume of blood. If that volume is too high, the pressure goes up. Diuretics reduce the volume, which reduces the pressure. The benefits? They're effective. They're usually inexpensive. They work quickly, and they've got a long track record of safety. The side effects. The most common one is that you'll urinate more frequently. Some people feel thirsty. Because you're losing water and sodium, you need to be careful about your electrolytes, the minerals in your blood that help your body function. Your doctor might recommend eating more potassium-rich foods, like bananas or spinach. In some cases, your doctor might monitor your potassium levels with blood tests. Some people complain of fatigue or dizziness, especially if the dose is too high or if they're losing too much fluid. And in some cases, particularly with certain diuretics, there can be sexual side effects. ACE inhibitors. These have names that end in pril, like lisinopril, enalapril, ramipril. They're some of the most commonly prescribed blood pressure medications. Here's how they work. Remember when we talked about your body's natural systems? Well, your body has something called the renin-angiotensin-aldosterone system. It's a fancy name for a process that helps regulate blood pressure by controlling blood vessel constriction. When blood vessels constrict, pressure goes up. When they relax, pressure goes down. Angiotensin II is a hormone in this system that causes blood vessels to constrict. ACE inhibitors block the formation of angiotensin II, which causes blood vessels to relax and pressure to drop. The benefits? They're very effective. They actually protect your kidneys, which is especially important if you have diabetes. They reduce your risk of heart attack and stroke. They might help protect your heart if you've already had heart failure. The side effects. The most common one is a dry cough. About 10 to 15% of people taking ACE inhibitors develop this. It's not dangerous, but it can be annoying. If you experience it, talk to your doctor. They might switch you to a different class of medication. Some people experience dizziness, particularly when they first start the medication or when the dose is increased. Headaches can occur. Rarely there's something called angioedema, which is swelling in the face or throat. This requires immediate medical attention. ARBs, angiotensin receptor blockers. These medications have names ending in sartan, like losartan, valsartan, olmesartan. They work similarly to ACE inhibitors, but through a slightly different mechanism. Instead of blocking the formation of angiotensin II, they block the receptors that angiotensin II attaches to. The effect is similar. Blood vessels relax, pressure drops. The benefits. They're very effective. They have similar kidney protective benefits as ACE inhibitors. Many people tolerate them very well with minimal side effects. The side effects. They generally have fewer side effects than ACE inhibitors. Some people experience dizziness or fatigue. Headaches can occur. The cough that happens with ACE inhibitors doesn't typically occur with ARBs, which is why some people switch from one to the other if the cough becomes bothersome. Beta blockers. These medications have names like metoprolol, atenolol, and propranolol. They work by blocking the effects of adrenaline on your heart and blood vessels. Adrenaline is what your body releases during stress. It makes your heart beat faster and harder. Beta blockers slow your heart rate and reduce the force of your heartbeat, which lowers blood pressure. The benefits. They're particularly useful if you have high blood pressure and heart disease. They reduce your risk of heart attack. They're often used after someone's had a heart attack to protect the heart. They can help with anxiety and panic attacks. They're good if you have high blood pressure combined with certain types of arrhythmias, irregular heartbeats. The side effects. Fatigue is common. Your heart is beating slower and less forcefully, so some people feel tired or have less stamina for exercise. Dizziness can occur, particularly when standing up. Some people have trouble sleeping or feel depressed. And yes, sexual side effects can occur with beta blockers. Beta blockers can also mask the symptoms of low blood sugar in diabetics, which is something to be aware of if you have diabetes. Calcium channel blockers. These have names like amlodipine, diltiazem, and verapamil. They work by relaxing the smooth muscle in your blood vessel walls. Calcium is involved in muscle contraction, so by blocking calcium, these medications prevent blood vessel constriction and allow vessels to relax. The benefits? They work well for many people. They don't have the cough side effect that ACE inhibitors have. They're often well tolerated. Some are particularly useful if you also have certain types of heart arrhythmias. The side effects. Swelling in the ankles and feet is common. This is sometimes called edema. It's not dangerous, but it can be uncomfortable. Some people get headaches. Flushing, a feeling of warmth and redness in the face, can occur. Constipation can happen with certain calcium channel blockers. Dizziness and fatigue are possible. Benefits people often overlook. When we talk about blood pressure medication, we usually focus on lowering the number. But the real benefit is what the lower pressure prevents. Heart attack prevention. High blood pressure damages the inner lining of your arteries. Plaque accumulates. Blood clots form. One day, a clot completely blocks a coronary artery, and you have a heart attack. By keeping your blood pressure controlled, you significantly reduce this risk. Studies show that every 10-point reduction in systolic blood pressure reduces heart attack risk by about 20%. Stroke prevention. High blood pressure damages the blood vessels in your brain, making them more likely to rupture or get blocked. Blood pressure medications reduce this risk dramatically. If you've already had a stroke, controlling your blood pressure is one of the most important things you can do to prevent another one. Kidney protection. Your kidneys are filtering your blood constantly. High blood pressure damages the tiny blood vessels in your kidneys. Over time, your kidney function declines. If it declines far enough, you need dialysis. Blood pressure medications, particularly ACE inhibitors and ARBs, actually protect your kidneys. They slow kidney disease progression. Heart failure prevention. When your heart has to work constantly against high pressure, it becomes enlarged and weakened. This is called heart failure. By controlling blood pressure, you prevent this from happening. Vision protection. High blood pressure damages the blood vessels in your eyes. Blood pressure medications prevent this damage and protect your sight. Brain health. High blood pressure contributes to cognitive decline and dementia. Controlling it protects your brain function as you age. Here's what I want you to really understand. You're not taking blood pressure medication to treat how you feel. You're taking it to prevent something bad from happening in the future. That's why it's so important to take it even when you feel fine. Now, I want to be honest about side effects. They're real. Some people experience them, some people don't. But they're not something to ignore. Dizziness. This is common when you first start medication, or when your dose increases. Your blood pressure has come down, and your body needs time to adjust to circulating blood at a lower pressure. It usually improves within a few days or weeks. If it persists, talk to your doctor. They might adjust your dose or change your medication. Fatigue. Some medications, particularly beta blockers, can cause fatigue. You might feel like you have less energy or endurance for exercise. This is usually temporary, but if it persists, your doctor needs to know. Swelling. Calcium channel blockers can cause swelling in your ankles and feet. This is usually not dangerous, but it can be uncomfortable. It's different from the swelling you'd get from heart or kidney disease. This is localized to your ankles and feet. If you develop this side effect, talk to your doctor. They might adjust your dose or try a different medication. Cough. ACE inhibitors can cause a dry cough that affects about 1 in 10 people. It's not dangerous, but it can be persistent and annoying. If this happens, your doctor can switch you to an ARB, which usually doesn't cause cough. Headaches. Some people develop headaches when they first start blood pressure medication. Usually this improves, but if it persists, tell your doctor. Frequent urination. Diuretics make you urinate more frequently. This is expected and usually not a problem, but it can be inconvenient, especially at night. If it's affecting your sleep significantly, talk to your doctor about timing your dose earlier in the day. Electrolyte changes. Particularly with diuretics, your sodium and potassium levels can shift. Your doctor will likely monitor this with blood tests, especially early on. Sexual side effects. Some medications can affect sexual function. This includes some diuretics and beta blockers. If you experience this, don't just suffer in silence. Talk to your doctor. There are often solutions: adjusting the dose, changing the medication, or combining it with another medication. Why not everyone gets side effects? Here's what's important to understand. Not everyone experiences side effects. Someone else's experience might be completely different from yours. Your genetics matter. Your body composition matters. Other medications you're taking matter. Just because your friend had a certain side effect doesn't mean you will. Common mistakes people make. I've seen these patterns over and over in my practice. Stopping medication after blood pressure improves. This is huge. Someone's blood pressure comes down after starting medication, so they think, great, I'm fixed, I don't need this anymore, and they stop taking it. Their blood pressure shoots back up. They've undone all the progress. Here's the thing. Blood pressure medication doesn't cure high blood pressure. It controls it. You typically need to take it as long as you have hypertension, which for most people is long-term. If your doctor says you can stop, that's different. But you shouldn't make that decision yourself. Taking medication inconsistently. Some people take their medication every day, then skip a few days, then remember again. This creates fluctuations in your blood pressure, which can actually be harmful. If you're on a once-daily medication, take it at the same time every day. If you have trouble remembering, use a pill organizer or set a phone reminder. Assuming medication replaces healthy habits. This is a big one. Someone starts blood pressure medication and thinks, okay, now I can eat salty food. I don't need to exercise. I can stay stressed all the time. No. Medication and lifestyle changes work together. The best results come when you're doing both. If you're experiencing a side effect, tell your doctor. Don't just suffer. There are usually solutions. Maybe your dose needs adjustment. Maybe you need a different medication. But you have to speak up. Self-adjusting doses. Never do this. If you think your dose is too high or too low, talk to your doctor. They'll adjust it properly. Self-adjusting can be dangerous. Believing medication means failure. This is heartbreaking to me. People feel like they failed because they need medication. They think they should be able to control their blood pressure through lifestyle alone. But sometimes your genetics, your age, your body's physiology means you need medication. That's not failure. That's being smart about your health. A realistic patient story. Let me tell you about James. He came to see me at 52 years old with a blood pressure of 168/102. He was shocked. I feel fine, he said. I don't understand why I need medication. I explained to him that feeling fine and being healthy aren't the same thing. His blood vessels were being damaged. His heart was working too hard. His risk of heart attack and stroke was elevated. But James was resistant. He'd heard stories about people being on blood pressure medication for life. He worried about side effects. He thought he could fix it through diet and exercise alone. I told him, here's what we do. We try an aggressive lifestyle approach first. He'd cut out salt, start exercising regularly, lose weight, manage stress. We check his blood pressure in 3 months. If it came down significantly, maybe medication wouldn't be necessary. James committed to this plan. He started walking every morning. He cut out processed foods. He joined a meditation class. He lost 12 pounds. 3 months later, his blood pressure was 145/95. Better, but not good enough. We needed medication. This time, James was ready. He understood that he'd done his part, but his body just needed extra help. We started him on an ACE inhibitor. Within a few weeks, his blood pressure was 128/82. He felt great. He had more energy than before. His doctor, that was great news. He realized that the medication wasn't a sign of failure. It was a tool that, combined with his healthy lifestyle, was protecting his future. 2 years later, James is still on the same medication at the same dose. His blood pressure is consistently controlled. His stress is down. He's in the best shape he's been in since his 20s. And he's not worried about having a heart attack or stroke anymore. That's what medication can do when you understand it and take it properly. Lifestyle still matters. I want to emphasize this strongly. Medication works best when it's paired with lifestyle changes. They're not competitors, they're partners. Healthier eating, a diet rich in fruits, vegetables, whole grains, and lean proteins, supports blood pressure control. The DASH diet, dietary approaches to stop hypertension, has strong evidence behind it. Reducing sodium. This is huge. Most of us consume way too much salt. Cutting back can lower blood pressure significantly, which might even allow your doctor to reduce your medication dose. Exercise. Regular physical activity, 150 minutes per week of moderate activity, reduces blood pressure, improves heart health, aids weight management, and reduces stress. It's powerful. Sleep. Getting 7 to 9 hours of quality sleep is important for blood pressure regulation. Poor sleep increases blood pressure. Stress management. Chronic stress elevates blood pressure. Finding ways to manage stress, meditation, yoga, time in nature, therapy, helps. Weight management. Every kilogram of weight you lose can lower your blood pressure. If you're overweight, this is one of the most impactful changes you can make. Smoking cessation. If you smoke, quitting is one of the best things you can do for your blood pressure and your overall health. These things work alongside medication. They don't replace it, and medication doesn't replace them. Together, they give you the best chance of protecting your health. 4 questions every patient should ask their doctor. If you're starting blood pressure medication, make sure you understand it. Ask your doctor these 4 questions. 1. Why am I taking this specific medication? Every medication works slightly differently. Your doctor chose this one for a reason. Maybe it's because of your other health conditions. Maybe it's because of side effect profile. Maybe it's because you have diabetes, and this medication protects your kidneys. Understand the reasoning. 2. What side effects should I watch for, and what should I do if I experience them? Know the common side effects. Know which ones are concerning enough to warrant calling your doctor immediately. Know that you have options if side effects occur. 3. How will we know if it's working? Is your doctor going to check your blood pressure regularly? What's the goal? Are they monitoring with blood tests? Understanding the plan helps you stay on track. 4. Are there lifestyle changes that could improve my results or eventually allow me to reduce medication? This is important. Some people can reduce or even come off medication if they make significant lifestyle changes. Some people will need to stay on medication indefinitely. Your doctor knows your situation. Ask what's realistic for you. Powerful conclusion. Here's what I want you to understand about blood pressure medication. It's not a punishment. It's not a sign that you're sick or that you've failed. It's a tool, and tools are only useful if you understand how to use them. The medicine isn't treating a number on a screen. It's not about making your doctor happy or your lab results look better. It's about protecting your heart, your brain, your kidneys, and the years of your life that haven't happened yet. I think about all the people I've known who had preventable heart attacks and strokes. People who felt fine one day and were in an ICU the next. Many of them had high blood pressure that wasn't controlled, and many of those events could have been prevented with medication and lifestyle changes. Blood pressure medication gives you that chance. It gives you the opportunity to live years longer, to be there for your grandchildren, to do the things you love without fear. But only if you take it consistently, if you understand what it's doing, and if you pair it with healthy lifestyle choices. The medicine is part of your plan. Your healthy choices are part of your plan. Together, they're protecting your future. I want to hear from you. Have you ever experienced side effects from blood pressure medication? How did you handle it? What questions do you wish you had asked your doctor when you were first starting medication? Drop your thoughts in the comments. Let's help each other navigate this. Your experience might help someone else understand their own situation better. And if this video was helpful, please like it. Subscribe so you don't miss future videos on topics that could change your health and your life. Share this with your family members or friends who are taking blood pressure medication. You never know whose understanding and peace of mind you might improve by sharing this. Thank you for watching. Take care of yourself, because you're worth it.